Hello and welcome to the Dr. Is and Dr. E's show.
I'm Dr. Is.
And I'm Dr. E's, and we is going to ease your mind about colon cancer.
Now, before you ask the question,
What's colon cancer?
let me tell you what the colon is and what it does. The colon is part of the large intestine. It's a 4 to 6 foot tube that attaches from the small intestine to the rectum. The rectum is also part of the large intestine.
The colon removes water from stool to help the large intestine process waste.
Now that we talked about the colon, let's talk about colon cancer.
So, Dr. Is, how does colon cancer develop?
Colon cancer starts out as polyps. Polyps are abnormal cells. These polyps don't always have a high risk of becoming cancer, and there's 2 different types of polyps, hyperplastic and inflammatory.
Which type should we be most concerned about?
Well, both of them have a possibility of becoming cancer, but if you have large hyperplastic polyps on the right side of your colon, you should be most concerned and get those removed as soon as possible.
How are polyps found?
Polyps can be found in any regular screening that you can do for any other cancer.
So, what would happen if the polyps were never discovered and were left alone?
Well, that would bring us from stage 0, which is the beginning of the polyps, to stage 1. At stage 1, the cancer is formed in the innermost layer of the colon wall and has spread to the next layer, maybe even the muscle layer. At stage 2, the cancer has spread through the muscle layer to the outermost layer, and it continues to spread. By the end of stage 3, the cancer is spread through the entire wall of the colon. But remember, the colon cancer isn't only growing up, but is expanding down into the colon, dangerously blocking the flow throughout the colon. Stage 4 is when the cancer travels throughout the blood vessels and spreads throughout the body, causing cancer in other areas of your body.
We'll be right back to the Dr. Is and Dr. E's show.
Please enjoy this infomercial.
Are you old?
Do you have changes in your bowel habits?
Such as diarrhea or constipation?
Rectal bleeding?
Abdominal discomfort? Then you may have colon cancer.
Often there are no symptoms for colon cancer until the cancer gets to be a large size, but if any of these are partially true, you should get a regular screening.
A screening consists of a digital exam of the large intestine and the testing of 3 stool samples for traces of blood.
If the screening has abnormal results, your doctor would perform a colonoscopy.
A colonoscopy is a complete evaluation of the colon and the rectum using a tube with a camera on the end, which is then shoved up the poop chute.
If cancer is discovered, depending on how early diagnosed, your doctor will then suggest surgery, radiation, or chemotherapy. Welcome back to the Dr. Is and Dr. E show.
We're going to be throwing out some fast facts about colon cancer. Cancer is uncontrolled division of abnormal cells.
African American men and women are more likely to get colon cancer than any other ethnicity. They are also more likely to get diagnosed with colon cancer at a later stage, which causes a higher death rate.
90% of new cases occur in people 50 or older.
Colon cancer is developed when the cells in your colon duplicate extraordinarily fast and they create a buildup that causes polyps.
20% of colon cancers are found after the disease has spread to distant organs.
Risk factors for colon cancer include a family history of colon cancer or different diseases like Crohn's disease, a diet high in red meats, obesity, smoking, physical inactivity, heavy alcohol use, and type 2 diabetes.
The risk of developing colon cancer is about 1 in 20.
It is expected to cause 50,310 deaths during 2014.
The risk of colon cancer is slightly lower in women than in men.
96,830 new cases of colon cancer in 2014.
Your survival rate for colon cancer found at the local stage is 90%. Your survival rate for colon cancer found at the regional stage is 70%. Your survival rate for colon cancer found at the distant stage is 12%.
Thank you for watching the Dr. Is and Dr. E show. I hope you enjoyed this informational piece on colon cancer.